as part of our question and answer series. The question is, what should my weight be when I come in for liposuction? Should I be at my ideal body weight? And that's a really important question that I get asked in a variety of ways. And the answer is not a one-line answer, as you can imagine. Basically, you need to understand what lipo does on a big scale, and then you can understand a little bit. So most of us have fatty disproportions. Even when we're at a really good weight, when our optimal weight, we have fatty disproportions. On a male, it might be the waist, lower abdomen, around the chin. On a female, you might add to that more about the hips and the outer thighs and the inner thighs and the arms and the inner knees, etc., etc. Liposuction permanently improves fatty disproportions, which is amazing. Now, yes, cool sculpting can often help do that. Sometimes when it's a bigger job, lipo's better, and not everybody responds the same way to cool sculpting. Some people want to say, I want what works for sure. Now that we understand better what liposuction does, let's go back to the question of what weight should you be. So you're not getting liposuction in order to lose weight. And whenever I think a patient might be thinking that's the case, I make it very clear. You're getting it to improve fatty disproportions, not for weight loss. Now what we're going to get into is something a little bit more interesting relating to weight, and why I basically say you should not be at your optimal weight when you get lipo unless you're always at your optimal weight. And here's why. If you artificially, the way I like to say it, if you through diet, which means temporarily instead of artificially, lower your body weight for a procedure to be near the optimal weight, then what do we know? We know your weight is almost certainly going to go back up, right? Because you lowered it for me. Not every day. So your weight's going to go back up. Keep that in mind. Now, let's think about even the best done liposuction. Even the best done liposuction has microscopic imperfections. Remember, we're not seeing the fat cells. We're looking at them and we're feeling them, but not seeing them with a camera under the skin. So there are little imperfections even in the world's best lipo that gets a standing ovation at the end of the procedure. Now, what is a little imperfection? A little imperfection means a few more fat cells were taken there, or more likely, there are a few injured fat cells that are crushed, but they're not going to die. They're going to recover. And so they are going to be there. There may be a few extra cells that just weren't injured compared to cells next to them. So there are all these little microscopic imperfections, even though from the outside you see perfectly smooth skin flap and nice contour. What happens if that person artificially, meaning temporarily, lost weight, when they gain it back, those little clusters of fat cells that have more, what's going to happen to them? They're going to grow. So the person that gained 10 pounds after lipo, it may not look as perfect anymore, it may not look as smooth anymore. So that's why I say you're better if you're a little up. Now, if you're 20 pounds up, okay, wouldn't be bad to start losing a little bit before. And remember, even after I'm done, you're going to have more to lose. But I hope that helps answer the question. Now, the unusual case that I have sometimes is a very lean person who has really very little fat around the abdomen, particularly centrally around the belly button. And on them, I tell them, you might want to gain a pound or two, because again, the bigger those fat cells are, the more likely I am to in an even way, take care of them, so that'll be resistant to fluctuations in weight in the future. So I hope this helps. Thanks.